Hey, everybody. Welcome back to the Healthy, Wealthy, and Smart podcast. I am your host, Dr. Karen Litzy, physical therapist and owner of Karen Litzy Physical Therapy, located in the heart of New York City. And on today's show, we are going to be talking about how and why muscle is a key to successful weight loss. So I'm really happy to have on the program Dr. William Davis. He's a cardiologist and a #1 New York Times best-selling author of the Wheat Belly series of books and more recently Supergut. Recent human clinical trials that Dr. Davies conducted have revealed that it is possible to lose fat and weight while preserving muscle. So, Dr. Davis, welcome to the podcast. I'm happy to have you on.
Oh, thank you. Thanks for the invitation.
Yes, it's great. And one thing I will say before we start is I have been, doing my research and looking through your YouTube channel, and I read the comments under the videos, and it's really quite amazing how many people you have helped with your books. Because all of the comments, you know how sometimes you have like negative comments or not. These were hundreds of comments of people who you've really made a difference. And I think it's a great example of how a healthcare provider can help many, and that we are not just stuck on the one-to-one interaction of one-to-one patient care. So anyway, I just wanted to throw that out there because I think it's really great. But today we are going to talk about why muscle is important and when it comes to weight loss. So before we get to that, can we talk about the more conventional ways people are losing weight these days and why, maybe that might not be the best course of action?
Most people don't think of it this way, but most conventional methods to lose weight are pretty much the same. We could call it move more, eat less, and other forms of reducing calorie intake. We could call it a GLP-1 agonist drug like Wegovy or Ozempic or Mounjaro or other pharmaceuticals that decrease your appetite, decrease your interest in food, make you feel full with very little food. Or it could be a bariatric procedure like lap band or gastric bypass that shrink the volume of your stomach. So they're all variations of the same theme, reduce calories. We now know with good confidence, good evidence, when you reduce calories, about 25% of the weight you lose is muscle. So let's say your neighbor wants to lose 40 pounds. She pays $12,000 for a year's worth of Wegovy, endures the nausea, etc., loses 40 pounds over a year. Of that 40 pounds, 30 pounds is fat, 10 pounds is muscle. Now, 10 pounds of muscle is a lot. Think about 10 pounds of ground beef on your kitchen table. It's a lot of muscle.
Yeah.
Well, she stops the drug because most people can't afford that forever. She regains the weight. She regains 32 to 34 pounds of fat, more fat than when she started, does not regain the muscle, very little muscle. And her metabolic rate is dramatically lower now. That is the rate at which she burns calories for the work of living, breathing, digestion, etc. And so she regains the weight. She's less healthy. She's more prone to type 2 diabetes. She's more insulin resistant. Her risk for coronary disease, cognitive impairment, Alzheimer's, and breast cancer are all now greater than they were at the start. She enriched the pharmaceutical industry with $12,000 and is now less healthy. This is the garbage that the FDA approved without outcome data. So she has a choice. Your friend has a choice. Stop the drug, become less healthier and fatter than she was at the start, or stay on it forever and further enrich the pharmaceutical industry and drain her savings of a lot of money. So the key here is loss of muscle. So whether you did it by cutting calories or a program of shakes or counting points, it doesn't matter. It's all and you lose muscle. And we know with good evidence, when you lose muscle, and by the way, the reduction in basal metabolic rate is, at least by NIH studies, about 27%. And it's essentially permanent. It doesn't come back. And when you regain the weight, because of distortions in appetite hormones, you're hungrier. You're hungrier now than you were at the start. So you're
Mhm.
fatter, you're more insulin resistant, and you're hungrier after weight regain.
Right.
This is the nonsense that gets passed off as very costly bariatric procedures, very costly GLP-1 agonists, and then all these programs, thousands of them to lose weight.
Right, right. And so as we're losing weight, we're also losing muscle. Um, so can you share with the audience, why is preserving muscle important? What do our muscles do? Aside from, we know they help to move our joints and they help for us to walk and function throughout the day. But from a cardiovascular standpoint, a metabolic standpoint, why is having muscle fibers important?
A whole long list of reasons. So it increases your metabolic rate. If you have
Mm-hmm.
a higher base metabolic rate, you're more likely to control weight regain and fat deposition. You're more agile. You're more able to navigate life, stairs, cars, driving, walking, riding a bike, all those kinds of things. You're less prone to frailty later in life. You're less prone to falls and fractures. Males have higher testosterone. So a lot of good reasons to maintain muscle. Of course, we lose muscle just by aging. So about a
Mm-hmm.
third of our muscle is lost just by aging. And then
I
you
know.
amplify it by these awful methods of weight loss. So now a lot of my colleagues fool themselves and say things like, oh, don't worry, my patients are all on Mounjaro or Wegovy, but I tell them they must strength train. It does not work. It's quite common. It does not work. It will blunt the effect. So there's a very recent NIH study. They took people with BMIs of 50 or more, so very big people,
Right.
put on a low calorie diet and an intensive exercise program, 2 hours a day, strength training and aerobic exercise, 6 days a week. I mean, extraordinary. They did it
Yeah.
for 6 months, about 127 pounds, of which 23 pounds was muscle. So less than the expected 25%, but still significant, so much so that their metabolic rate was so low that they only had to take in 400 calories per day before they started regaining weight.
Oh boy.
That's how awful. And of course, they're hungry now. So
Right.
losing weight by cutting calories is an absolute disaster,
Well, and
and you cannot protect yourself fully
that
with strength training.
sure. And that reminds me, remember that show, The Biggest Loser,
Hmm.
on NBC or whatever channel it was on, and they would take people kind of like you said who were, very, very overweight. They would starve them and work them to death for however long it was. And then they would all, for the most part, most of them gained the weight back. And for those reasons, exactly like you just said. And it would be great while they were there, but then they have to go back to real life where you actually have to eat food and you may have children, or you may have a life that you have to run, and you can't work out 6 hours a day, 7 days a week. But now that you explained that, boy, The Biggest Loser really makes a lot more sense now.
So Danny Cahill won the eighth season. He started at 430 pounds. He lost an incredible 239 pounds over 210 days. Extraordinary. On an 800 calorie per day diet, expending as much as 8,000 calories. So
Oh my
misery, but
God.
testifying how powerful this guy's commitment was. He won. He got the $250,000 prize. Looked terrific, by the way. Tall, slender, good looking guy at the end. Left the show, regained 200 pounds. He was among the people who the NIH studied, the graduates of that program. So,
Oh, that's
calorie
interesting.
reduction,
Uh-huh.
extreme exercise, and they all experienced a dramatic reduction of metabolic rate. The study only lasted for 6 years after the completion of their participation,
Hmm.
and because they didn't just no one has a budget goes on forever, so
Sure,
they stopped
sure.
at 6 years. They never regained control over their metabolic rate. And I talked to Danny. He's regained all the weight. They have reunions where they get back together, and he says they're virtually all regained the weight. But as you point out, it is testimony to the folly of trying to lose weight without paying attention to muscle. And it has to go beyond strength training. Strength training is good, but it's
Hmm.
insufficient.
Hmm. So what else do we need? We've got lower metabolic rate and sarcopenia, that loss of muscle mass as we age, stress, cortisol. I'm sure that affects your preservation of muscle. So what can we do to preserve muscle and help us as we get older?
So I stumbled into a lot of this. So I was having people restore a gastrointestinal microbe that almost everybody has lost. It's ubiquitous in mammals, wild mammals. It's ubiquitous in hunter-gatherer populations who don't get exposed to such things as antibiotics. Lactobacillus reuteri, Reuteri, named after the German microbiologist who isolated this microbe in 1962 from a German mother's breast milk. And through his 40-year academic career, he found it increasingly difficult to find anymore. It disappeared. And so almost nobody has Lactobacillus reuteri anymore, even though it's ubiquitous in animals and hunter-gatherer humans. Well, because of some preliminary animal evidence that restoring reuteri provokes all these incredible effects, such as acceleration of healing, reversal of thymic atrophy, thymus gland seat of T cell immunity, increases dermal thickness, an explosion in collagen, it accelerates healing, it increases testosterone and Leydig cell volume in males, a whole bunch of incredible. So I thought, let's try it in humans. So I got the same microbe that they used in these studies. They were performed at MIT in mice. And at the time, we could only get it in very small doses because the tablets were called BioGaia Gastris tablets. It was a product made for children to reduce regurgitation of breast milk or formula, things like that. Not very interesting, right? But I got the microbe, very low dose, made for infants. Well, how do you increase it? Well, you could take 100 tablets a day, which is ridiculous, of course.
Right.
So I fermented it it looks and smells like yogurt, but it's not yogurt, of course. It just happens to look and smell like yogurt. We ferment it using my method of prolonged fermentation. So Lactobacillus reuteri doubles every 3 hours at human body temperature. They don't have sex, right? They just double asexual reproduction. So we ferment it for 36 hours, and I counted the microbes using flow cytometry, and we get about 300 billion. So we increased the levels, the numbers, 1,000-fold from the original numbers. And it looks and smells like yogurt. It's a little tart because of the lactic acid content. We get to a pH of 3.5, 10-fold more acidic than conventional yogurt. We consume a half cup per day, and lo and behold, this usually does not happen. Observations made in mice often do not translate into humans. In this situation, everything they've seen in mice has played out in humans, both in formal studies as well as my large anecdotal experience. So among the effects, ladies lose their wrinkles. They lose their crow's feet and their smile line.
You have me. You have my attention.
Over a longer period, the deeper wrinkles like forehead and nasolabial fold that require more collagen takes longer, but they also start to recede. There is a restoration of youthful muscle. I personally, when I did this several years ago, I'm in my late 60s. I hate going to the gym. So I go 15 minutes once a week to use the machines and get the hell out. And I gained 13 pounds of muscle. My strength increased by 50% over 3 weeks. First, I thought, what? This can't possibly be. And then I've seen this play out numerous times. There's an increase in libido. Males experience a 50% rise in testosterone. Ladies experience also rise in libido. And older females experience a restoration of vaginal moisture and sensation. There is preservation of bone density. That's human data. There's amplification of the immune response. All these things. Well, crazily, though, the ladies in my audience is largely female. They say, oh, we don't care about all those things. We just want better skin. So I thought, all right, fine. So I did a small human clinical trial, 25 ladies. And we said, don't change your diet. Don't change your exercise program. Just get these 4 things. It was 4 things. It was Lactobacillus reuteri, and I added in a few other things to stack the odds in favor of better skin response. So marine source collagen peptides, hyaluronic acid. And by the way, those 2 things, collagen and hyaluronic acid, largely absent from the modern diet because we've been told, stupidly, to cut our fat and cholesterol, saturated fat and cholesterol, for which there was never good evidence. So people abandoned consumption of organ meats, thereby a diet depleted in collagen and hyaluronic acid, which have major effects on skin and on body composition. including muscle. And then lastly, because of carotenoid poor diets nowadays that are reliant on processed and ultra processed foods, so depleted in carotenoids, I added just the most potent carotenoid of all, astaxanthin. That's the orange in, for instance, in salmon.
Oh,
So I
okay.
had these ladies take these 4 things over 90 days. Because it was a skin trial, we did things like high resolution skin ultrasound, and we documented a dramatic increase in dermal thickness. And the ladies were thrilled because they lost their wrinkles, blah, blah, blah. But we also just happened to measure their waist circumference. It was a skin trial, but we happened to measure their waist circumference. To my great surprise, the ladies lost huge amounts of abdominal fat. But even more incredibly, didn't lose weight. How can you lose up to 8.5 inches off your waist circumference, but not lose weight? Well, consistent with the animal evidence and my large anecdotal human evidence, increased muscle. So we're seeing it as more firm shoulders, firm necklines, firmer thighs, and buttocks. So loss of fat, abdominal fat, that's the most problematic form of fat, of course.
Yeah, I was gonna
as
I was gonna ask you why that abdominal fat or visceral fat is kind of the worst.
Yeah, because it's the seat of inflammation and inflammatory mediators and insulin resistance that is the driver of weight gain and the blocker of weight loss. So being able to target abdominal fat really helps, as opposed to subcutaneous fat below the skin. So I believe we stumbled on a way to specifically target abdominal fat while preserving or even increasing muscle. Now we've got more work to do. I want to quantify that. Also, we'll have to resort to either DEXA or cross-sectional CT or MRI at L4, L5 level to look at the distinction between subcutaneous and abdominal fat. But, we're talking about making yogurt and adding some things. In other words, if the solution was something expensive or ridiculous, like a GLP-1 agonist or bypassing your stomach, well, we better be damned. But what if the solution is something like that looks and smells like yogurt and maybe a couple of supplements? So that's what we're seeing. We're seeing a reconfiguration of shape and body composition doing this. Now, one of the things I'd like to do, we'll need to do a partner because the funding is difficult, is what if we did that, those things, Reuteri, collagen, hyaluronic acid, and a carotenoid, concurrently with the GLP-1 agonist? Could we block the loss of muscle or at least reduce it and thereby allow that person to come off the GLP-1 agonist and not regain the weight? So we need to do that expensive trial. But I think we may have stumbled on such a thing.
Oh, that's great. Yeah. And have you found any potential negative side effects from the yogurt, quote unquote yogurt, or from the supplements? What were the
I'm being a wise guy, but yes, people will say, did you get Botox? Did you get filler injections? Did you have liposuction? In other words, body shape and composition changes. There really is no downside. The only downside is, so about half, in my view, half the US population has developed small intestinal bacterial overgrowth. We say SIBO, S-I-B-O.
Oh, yeah.
That is loss of fecal microbes due to antibiotics and other factors has allowed proliferation, overproliferation of fecal microbes that now have, in half the US population, in my view, have ascended to the small intestine, 24 feet of small intestine. Well, the small intestine is very permeable because that's where we absorb nutrients. So these trillions of fecal microbes live and die rapidly. They only survive a few hours at a time. When they die, they shed their toxins, specifically endotoxin, lipopolysaccharide endotoxin. Well, that gets into your bloodstream. That's called endotoxemia. And that is a major driver of weight gain, insulin resistance, body-wide inflammation. But you might not know it because you're thinking it's just anxiety or suicidal thoughts or depression or cognitive impairment or rosacea or psoriasis or fibromyalgia or sleep apnea or fatty liver. In other words, we've got to rethink virtually all chronic human diseases that we're familiar with in light of the contribution of the microbiome, but specifically the small intestinal microbiome and the endotoxemia that results. So one of the effects of Reuteri, so one of the reasons why all these beautiful, wonderful effects develop is because Reuteri takes up residence in the GI tract, sends a signal to your brain via the vagus nerve to release oxytocin. So the hormone of love and empathy. So the intensity of your love and affection for the people close to you will intensify. You'll be more generous. You're going to like other people better. You're going to have less social anxiety. And my favorite, you'll be more accepting of other people's opinions. And I call oxytocin the hormone of body shape and composition, restoration of muscle, loss of abdominal fat, smoother skin. People have Ozempic face, for instance, with the GLP-1, they look 10
Yes,
years older.
it's sort of like it's like what is happening there?
Well, the GLP-1 agonists are preferentially target subcutaneous fat, not abdominal visceral fat.
Oh,
And
I
you lose.
see.
Mhm.
Got it.
So
Got it.
they look 10 to 20 years older. We look 10 to 20 years younger. So that's the oxytocin effect. But there's another really interesting aspect to Lactobacillus reuteri behavior, and that is it's unique in that it colonizes the small intestine. Very unusual. Most microbes don't colonize, they colonize the colon. Well, Lactobacillus reuteri colonize the 24 feet of small intestine and the colon, where it takes up residence and produces what are called bacteriocins. These are natural antibiotics effective against fecal microbes. So we're storing this lost microbe that produces oxytocin and colonizes the small intestine, produces bacteriocins, pardon me, is the first step in eradicating SIBO. And so far, we've used, actually what we've been using to eradicate SIBO is a combination of Lactobacillus reuteri, Lactobacillus gasseri, also a small intestine colonizer and bacteriocin producer, and a spore former, Bacillus coagulans, probably interchangeable with Bacillus subtilis. We co-ferment those three as the yogurt, get 300 billion total counts, half cup a day. So far, this is just anecdotal. We hadn't yet done the clinical trial. Of 50 people who've done this, 90% have normalized their SIBO. That is by breath hydrogen gas measurement. Do you guys know about the air device?
No.
So it's just it's called the Air Device, AIRE. I have no relationship with the company. I know the inventor, Dr. Angus Short in Dublin, Ireland. He's an engineer and he's a friend. This device came out. Now it's this one. This one measures hydrogen gas. This one measures hydrogen gas and methane. So you blow into it, it talks to your phone, 0 to 10 for those gases. Those are gases produced by microbes, not by you. And you can use it to map where microbes are living. Are they living where they're supposed to be in the colon, or have they invaded the 24 feet of small intestine? You can tell that with that device. I had believed for many years that SIBO was this rare thing. No, it's everywhere. So people are testing positive left and right. But the great thing is you normalize it, in this case with what I'm calling SIBO yogurt, those three microbes, and they're normalizing breath hydrogen gas, and a lot of the phenomena associated with that go away. So if somebody had residual pain from fibromyalgia, it goes away. If someone was stuck in a weight loss plateau, it breaks. If they were a former type 2 diabetic, they go on the basic program, drop their hemoglobin A1C from 11.7%, say, to 6.1%. Still not great, better, but not great.
Right.
We went into the 4 range.
That's
they
right.
do this hydrogen gas, get rid of SIBO and endotoxemia, and their hemoglobin A1C is now 4.8%. So over and over and over again, we're seeing people who eradicate their SIBO normalize some aspect, or actually many aspects, of their health.
Yeah. And so, in all of your work, whether it be the anecdotal trials and more formal trials, was there anything that surprised you?
I did not know that we could so readily restore muscle. And I did not know that we could readily target. Now, one thing I can't say, just when you lose abdominal fat, how much is abdominal visceral fat? How much is subcutaneous fat? But the preliminary evidence suggests a lot of it's abdominal visceral fat. And so I think we have stumbled on a way to really reconfigure the body. So we're leaving the age of weight loss. Weight loss is dumb, right? Because it guarantees failure and it guarantees deterioration in health. So people, there's even evidence to suggest if you lost weight by reducing calories, whether we call it move more, eat less, or a shake program, a meal replacement program, or GLP-1 agonists, or a bariatric, whatever, that you likely shortened your life. Not only are you less healthy, and more prone to dementia and heart disease, etc., you're also likely to have shortened your life. And so I think we now, so that's the old way. That's the old wrong way. I think the better new way is to restore factors that, so I added those factors to the Reuteri, like collagen peptides. Collagen and hyaluronic acid, by the way, are absent from the modern diet because we've been told this nonsense to cut our saturated fat and cholesterol, for which there was never good evidence. So people abandoned consumption of organ meats like heart and tongue and stomach and intestine, rich in collagen, hyaluronic acid. So we restore those things absent because most people don't want to go back to eating heart and tongue and kidney and that kind
Yeah,
of stuff.
I got to tell you, I can't get into that. Because I know there's some delis here in New York that have like a tongue sandwich. And I remember the first time I went to Katz's Deli and it was on the menu, and I was like, "What's a tongue sandwich?" And they're like, "It's a cow's tongue, sliced very thin." And my friend and I both looked at each other and didn't even talk to each other, just looked at the waitress, and we're like, "We'll have the hamburger." It's just like I was like, I can't get into like sweetbreads, like I can't wrap my brain around it. And I mean, I grew up in an Italian household and my grandmother used to cook tripe and things like that. And I think I was scarred as a child. I can't get past it. So luckily there are other ways to get the benefits of that.
People people who are from Europe or Asia are more likely to do these things, but most
Mm-hmm.
Americans have become squeamish about these things. And
Yeah.
so we're left with collagen peptides. And by the way, hyaluronic acid, lots of ladies say, "Oh, don't tell me about hyaluronic acid. I know all about it because I apply it as a serum to
I was
my
going to say
eyes."
it's in everything these days.
Mhm. Well, that always surprised. It does help a little bit, but its penetration to the dermal layer. So it's the epidermis on the surface. It's the dermal layer that's the primary driver of skin health and appearance, though.
Mm-hmm.
So if a woman applies I ask ladies this, okay, you put the hyaluronic acid serum that you pay a lot of money for, by the way,
Oh,
around
yes.
your eyes, reduce the wrinkle depth. What did it do for the skin on your neck or your thighs or nothing, of course, because it's
Mm-hmm.
topical and local. Well, when you take hyaluronic acid orally, it distributes to all skin areas, and you have increase in dermal thickness body wide, significant. You also have an increase in dermal moisture because the hyaluronic acid molecule is very good at retaining water and also further stimulates fibroblast production of collagen in the dermal layer of skin, also in the chondrocytes of your joints. So it's a way to regrow collagen in your joints and increase
Yeah.
the synovial fluid volume in your
Yeah.
joints. And the uterus, cervix, and vagina is largely hyaluronic acid, as is the brain, and as is the glycocalyx lining the arteries that controls arterial tone or endothelial tone. So hyaluronic acid is this massively underappreciated nutrient absent. And I see people buying boneless, skinless chicken breast. The skin is rich in hyaluronic acid
Hmm.
and collagen. So and hyaluronic acid is very unique in that it's a fiber sourced from animals. Most fiber comes from vegetables, of course, plants. But here's an example of a fiber that comes from animals, mostly skin and brain and some other organs like tongue. Well, you eat this fiber from animals, and it causes a bloom in beneficial species. Species like Akkermansia or Faecalibacterium, or rumification, Lactobacillus. It also suppresses those fecal microbes, the proteobacteria, and decreases endotoxemia. So this one fiber that ladies know all
Right.
about for topical application are missing out on a huge opportunity for this unique fiber to exert, because when you do that, when you bloom those species, Akkermansia, Faecalibacterium, those are so-called butyrigenic species that produce butyric acid. And butyric acid is the mediator of improved insulin resistance, reduced
Got
blood
it.
sugar, reduced blood pressure, deeper, and it goes to your skin and acidifies the skin. So
Mm-hmm.
healthy skin is acidic, mildly acidic, like about 4.5.
Mm-hmm.
Unhealthy skin, someone with acne or eczema or psoriasis or rosacea, is less acidic, like 5.5, or even into the alkaline range. So when you consume a fiber like hyaluronic acid, you bloom those butyrate producing species. That butyric acid goes to the skin, acidifies the skin, and it discourages skin rashes because it discourages proliferation of a skin pathogen, Staphylococcus aureus, and encourages a skin commensal, a healthy bacteria, Staphylococcus epidermidis, and you see skin rashes, redness, and roughness recede just with that one fiber.
Cool. And also, you mentioned joints. A lot of patients with osteoarthritis will get hyaluronic shots into their joints, before considering, going for a more aggressive procedure, total hip or total knee replacement. So as a physical therapist, I see a lot of patients post hyaluronic acid shots into joints. So I'm glad that you mentioned about cartilage and things like that, because that's something as PTs that we are certainly seeing.
Here's food for thought. So we know that Lactobacillus reuteri via oxytocin stimulates chondrocyte production of multiple components of cartilage. We know that collagen, that joint cartilage is about 70% collagen. And collagen is prone to degradation, deterioration, and glycation, high blood glucose. We know that the hyaluronic acid, as you pointed out, is a component of the synovial fluid, and that the astaxanthin has huge effects on suppressing inflammation, especially like nuclear factor kappa B and some others that are so-called the mediators of inflammation, the inflammation of aging.
Yeah.
Put that together, I believe, this is anecdotal, we've not done the clinical trial yet. I'd like to do it down the road. I believe we have an osteoarthritis reversing formulation.
Well, that would be amazing, because having a total knee and a total hip replacement, as you know, is not easy. It's not fun. And people will really try anything to avoid that. So if there is something that can be done in the future for those folks, that would be pretty amazing.
I have two kids, 30 and 32, and their mom and aunt had their hips replaced around age 50. And these are slender tennis playing kids. These are not obese. These are slender. And so I don't want my kids to have to go through hip replacements or knee. So I have them on this combination of Lactobacillus reuteri, collagen peptides, hyaluronic acid, astaxanthin. Now, maybe there are ways to amplify that effect. And it's a slow effect. So you don't take it on Monday and you have better joints on Wednesday.
Yeah,
it's
I was just gonna ask that. How long do you have to take these combinations of the L-Reuteri? Am I saying that correctly? And how long do you have to take it for? We talked about the Wegovy's and Ozempics. If you stop taking it, you're in trouble. So with this, is this something you're taking for the rest of your life? Is this how much do you have to take? What's the prescription?
Well, when you think about it, all the things we're talking about are really restoring things you and I should have had all along anyway. So mom should have given you Reuteri at childbirth or breastfeeding, and you should have had it for a lifetime. But it got wiped out by antibiotic exposure and glyphosate and all the other things we're exposed to. The collagen and hyaluronic acid we should have been getting because you eat tripe and you eat casings on sausages and you cook heart and tongue, but no one wants to do that. Very few people want to do that. And of course, the ultra-processed world of food and the lacking carotenoids. So all we're doing is restoring things that are absent, but you should have been getting. So it is a lifelong. We don't have a timeline because we've not been doing it long enough. I've only been doing this for a couple of years. I think I think we're seeing reversal slow and sure, like a year or two of osteoarthritis, but we've not quantified it formally. I'd like to do that because it would be wonderful if I had, like for my kids, a way to say, here's a way to not have. Because if we ask John Q primary care, hey, doc, I don't want to have arthritis like my mom and dad. What can I do? Nothing.
Yeah.
Take naproxen? No. Take ibuprofen? No.
Right.
So there's nothing in the conventional armamentarium to prevent arthritis. Now, I don't know how good it will be as a treatment for arthritis. It's probably a lot better as a preventive effort for arthritis.
Right. Well, I mean, I have to say, you've given us a lot to think about here. How would you wrap this up for our listeners? What are the big takeaways you want them to come away with from our discussion?
I look at the microbiome. I'm a cardiologist, so I'm not a microbiologist,
Right.
but I got to say, the world of the microbiome, kind of like AI, it's changing everything. And if you
Totally.
don't jump on this bandwagon, you're going to look like a dumbass because the tools for manipulating. So I just told you about Reuteri, a little bit about Gasseri, Bacillus coagulans, and Bacillus subtilis, but there's a lot of other things you can do. For instance, you want to reduce muscle injury during strenuous labor or exercise. Cultivate Bacillus coagulans. If you want a healthier child, baby, after delivery, make sure that child gets Bifidobacterium infantis because it allows that child to metabolize human milk oligosaccharides in breast milk. That child will be much healthier, will have improved neurological maturation, will have less likely to develop type 1 diabetes and type 2 diabetes later in life, and will have a higher IQ. Or a woman can replace Lactobacillus crispatus, which should be the dominant vaginal microbe that
Hmm.
reduces risk for miscarriage, premature labor, because premature delivery of a child is catastrophic.
Of course.
Uh,
Yeah.
reduces vaginal infections like Candida vaginitis and E. coli vaginitis, reduces the frequency of urinary tract
Mm.
infections, and even reduces urge incontinence. When you cough or laugh, you pee.
Yeah.
So these are crippling problems for a lot of ladies. Well, restore Lactobacillus crispatus. And you know what? It is the most delicious yogurt you've ever had. This vaginal microbe makes a delicious yogurt. It tastes like cream cheese.
I have to say that is the first time that statement has ever been made on this podcast. So it sounds like there are a lot of opportunities to be had. And like you had mentioned, more research needs to be had, but it looks like um, things are moving in the right direction for sure. I first spoke with Dr. I think it's John Crane. He's also out of Ireland about the microbiome, probably in 2015. 2016 on this podcast. And I remember that's the first time I had really even heard of the microbiome. And it was after I saw him do a TED talk on it. And uh, things have definitely progressed in that time, in those 9, probably 10 years, I guess.
It's really a really exciting time because
Mm-hmm.
it's going to change. This thing that slows us down is physician education because there's no fancy saleswoman or salesman hawking these things that no one's making a lot of money at it. There's no pot of gold for the pharmaceutical industry. These are
Mm-hmm.
things that you do on your own. So that's good and bad. So once you get acquainted with some of these microbes, and that I only scratch the surface. There's a ton of things more you can do.
Sure.
We hadn't even touched about fermented foods, which is a hugely powerful way to restore health. That's
Mm-hmm.
really interesting. But there's so much now known. There's more to learn, of course,
Yeah.
but it's looking like so uric acid hyperuricemia is a disease of the microbiome. Oxalate is a disease of the microbiome. It's virtually certain lots, perhaps most, emotional, social, and psychiatric illness is really a disease of the microbiome.
Mm-hmm.
On and on and on. And we're getting smarter and smarter on ways to manipulate it and restore it.
Yeah. And I think it's a really fascinating field of study. And if it can play a part in reducing chronic disease in the United States and reducing our burden of disease, which is the money, the lost time, the lost work, et cetera, et cetera. Um, I think it would just help overall health and the healthcare system, minus the pharmaceutical companies, um, in this country for sure. Now, as we are wrapping up here, where can people find you if they want to learn more about you? They want to maybe check out your books, things like that.
So Supergut has most of these recipes. That's a good place to start.
And that's the
I have
book.
a That's the book
Yeah.
Supergut. I have a blog and website called drdavisinfinitehealth.com. There's several thousand blog posts, several 100,000 discussion forum posts. We do a two-way Zoom most Wednesday evenings where we talk about these things for a couple of hours. People say, "Why did my yogurt not turn out?" and crazy things like that. So I try to make sure this is all accessible to everybody.
Perfect. And we'll have links. So regardless of what platform you're listening on right now, we'll have links to everything in the show notes. So we'll have links to the book and links to your website, et cetera, et cetera. One more question. It's one I ask everyone. And that is, knowing where you are now in your life and in your career, what advice would you give to your 20-year-old self?
That's a really tough question because, I did undergraduate work and then, of course, medical school, then residency, and then fellowship. So 17 years to do invasive cardiology, only to have my mother die of sudden cardiac death about 4 months after her successful coronary angioplasty. So she died of the disease that I was managing when I was in Milwaukee, Wisconsin, setting up new technology. So it drove home to me how inadequate my education and training was. And so that's when it opened my eyes. So I regret having wasted all that time. And then on the other hand, it also made me in tune and understand how wrong conventional healthcare is.
Mm-hmm.
So I think I just tell my 20-year-old self is stick with it, Buster. Things will get better. Your eyes will be opened eventually. It might take 30 years and making a lot of mistakes. But you'll see things that will help people enormously, things that empower people and don't do things like charge their healthcare insurer $1,000.
Right, right. Well, I think that's great advice for your younger self. And I want to thank you for taking the time and coming on the podcast, sharing all of this. Again, for people who are listening, it's drdavisinfinitehealth.com. So, Dr. Davis, thank you so much.
Thank you. My pleasure.
And everyone, thanks so much for tuning in today. Have a great couple of days and stay healthy, wealthy, and smart.